Hello, my name is Alexandra Dorchelle, and I will be doing my assessment of the musculoskeletal system on my patient here who has given consent and who has, I've already explained everything to her on what we'll be doing today. I've already introduced myself, washed my hands, and given her privacy. The first thing that we're going to do is observe the patient's gait. So we're going to have the patient stand up. And then we're going to have her walk towards the camera. Okay, walk back. Okay. And what we're looking for is we're looking to make sure that the patient's weight is even and she's standing on her heels and toes. I'm looking at her posture is erect, and as she walks, both her arms swing in opposition and her stride is appropriate. Any signs such as falling backwards could be an indication of spondylosis or Parkinson's disease. Now we're going to have the patient sit back down. The next thing that we're going to do is we're going to palpate and assess, inspect and palpate the temporomandibular joint. We're going to first inspect and then we're going to palpate. I'm going to use my index. I'm going to use 2 fingers and place it on the patient's jaw, right near her ears. I'm going to have her open her mouth and close it, and then protrude her jaw and have her retract it to see if there's any decreased range of motion in her jaw. Okay, so first I'm going to palpate. Well, first I inspect. So everything looks symmetrical, nothing's swelling. Now I'm going to palpate. And then I'm going to have the patient open her mouth and close it. And then protrude and retract. Go back. Yeah. Do it again. Retract. And is there any pain or anything? No. Okay. And I did not notice any decreased range of motion, so that's what we're looking for, which is normal. If there's any swelling, any tenderness or crepitus, it's usually seen in patients with arthritis. The next thing that we're going to do is we're going to inspect and palpate the sternoclavicle joint. And we're going to have the patient sitting like this. We're going to palpate. And what we're looking for, we're looking to see if it's midline, if there's any swelling, any tenderness, or inflammation of the joints. Okay. And do you feel any pain?
No.
Okay. Perfect. The next thing that we will be doing is inspecting and palpating the cervical, thoracic, and lumbar spine. We are going to have the patient stand straight. Okay. Stand straight. And we're looking to make sure that she's standing erect. We're looking for symmetry of both of her shoulders, to make sure they're the same height. We're looking at the height of her buttocks, the crease of her buttocks, to make sure that they're also the same height, and note any differences in the iliac crest. We want the cervical and lumbar spine to be concave like this, and the thoracic to be convex. Okay, and the spine is straight as you observe her from behind. So her spine is straight. Any abnormalities, like such as convexity of her cervical and lumbar spine, could be sign of scoliosis, or maybe obesity or pregnancy if the lumbar curve is exaggerated. Okay, so now we're going to palpate her spinous process to test to see if there's any tenderness, if there's any muscle spasms, to make sure it's smooth. Okay, and we're palpating both sides at the same time. Okay. Do you have any pain or any tenderness?
No.
Okay, I don't know. I do not feel any masses. Everything seems smooth. Even on both sides, everything's symmetrical, so that is a normal finding. Now we're going to test the range of motion of her cervical spine. And doing this, we're going to ask the client to touch the chin to the chest. Okay? When you touch the chin to the chest, that is called flexion. And when you have the patient look up to the ceiling, that is hyperextension. And the flexion of the cervical spine should be 45 degrees when it's flexed, and then 45 degrees when it's extended. So now we're going to have the patient touch her chin to her chest, and then we're going to have her look up to the ceiling. Okay, so the angle should be 45, and go back to touching your chin to your chest. Again, the angle is 45 degrees angle. We're going to do the lateral bend, and the lateral bend is going to have her bend her head like this. On this side, 40 degrees. Straight back. Do the same thing on that side, 40 degrees. And now we're going to do the rotation. We're going to go like this.